Hello, my name is Allie Diesel, and I'm a veterinary dermatologist at Texas A&M University. While we see all kinds of skin diseases in our veterinary patients, from parasites and infections to solar-induced skin disease, autoimmune skin diseases, and certain types of skin cancer, allergic skin disease and superficial bacterial pyoderma or skin infection remain a big part of what we manage on a daily basis. These topics are a huge focus in the veterinary dermatology community, so much so that conferences, textbooks, and research projects continue to be dedicated to these important aspects in our field. For that reason, I've been asked to shed some light on a few commonly received questions from our friends over at VetriMax Veterinary Products. So let's get to it. VetriMax writes, "Dear Dr. Diesel, how many veterinary dermatologists are in the United States? And how do I know when is the right time to refer a patient to a specialist?" Well, according to the website for the American College of Veterinary Dermatology, there are 378 diplomats, veterinarians that have become board certified and specialists in the treatment of dermatological conditions in companion animal species. Additionally, there are 54 residents in veterinary dermatology at various stages of their training in their training programs. Now, with regards to when is an appropriate time to refer a dermatological patient to a specialist, there was actually an article that came out recently in DVM 360 magazine. And what that article found was that if a patient with skin disease was referred earlier in the disease process to a veterinary dermatologist, this led to improved overall patient outcome, improved happiness from the client, as well as decreased expenses to the client and patient overall. The article actually found that there was a tipping point in frustration to the point where a client was much less likely to return to a veterinarian and much less happy with the overall success and treatment of their dog or cat. And what they found was that if that patient did not have the problem resolved after 3 or more visits, or when the veterinary bill topped out at $925, that was the tipping point of frustration where it was much less likely for that client to be happy. So overall moral of the story is that if you have a patient with skin disease, that treatments really aren't going the direction that you'd hope. It really would be beneficial to refer that patient to a veterinary dermatologist much earlier on before that client has a chance to get frustrated with the condition. Now, next question that comes through is that for dogs, what conditions seem to be most challenging for the general practitioner and are or should ultimately be referred to a veterinary dermatologist? Are there any breeds that are overly represented for these conditions? Now, there are a lot of skin conditions in veterinary medicine that are a bit trickier to either diagnose or treat. Certain ones that fall into that would be the autoimmune diseases such as pemphigus foliaceus, erythema multiforme, and vasculitis. We can see recurrent otitis externa or media, when ear infection has traveled down not only through the external part of the ear canal, but down into the deeper structures of the ear. These can be incredibly difficult for practitioners to manage, especially when resistant infections are also concurrently in play. Cocker spaniels and other spaniel breeds, dogs that have those low-hanging floppy ears, tend to be at a bit more risk for these recurrent ear infections and ear problems. Now, along the lines of resistant infections, when we have resistant bacterial infections of the skin, especially those with methicillin-resistant staph, either Staph pseudointermedius or Staph aureus, when especially the infection is deeper seated in nature, not just superficial or surface, but more deep in the tissue, these also should be referred to veterinary dermatologists. There are different types of antibiotics that come with side effects that might require some additional monitoring or administration considerations and really would be better in the hands of a specialist for those conditions. Now, atopic dermatitis or environmental allergies is one of the most common conditions that we see in companion animal dogs. Now, this is something that can be quite mild, but can also be really quite more severe and difficult to manage. This is a condition that's probably one of the most chronic diseases we treat in veterinary medicine. And given the chronicity and the intricacies in managing these patients, it's often beneficial to refer them to a veterinary dermatologist to help tweak and kind of massage that protocol to get the best management, the best comfort out of that allergic patient. There are certain types of medications, certain types of therapeutics that might be considered, often used in combination to get the best treatment outcome. This can be a bit more frustrating for the general practitioner, and so especially if things aren't going the direction that you'd like, referring these to a veterinary dermatologist can be incredibly beneficial. So when a patient is examined by a dermatologist, what sort of diagnostic tests might be done? And are there any useful tips that general practitioners should consider when evaluating patients that have skin disease? Now, when it comes to any animal species, whether it be dog, cat, horse, cow, pig, chicken, whatever, the biggest part of that dermatological exam is taking a very accurate and very thorough history and establishing whether or not that patient is indeed pruritic, whether that patient is itchy. When it comes to itch, there are some common things that cause itch, especially including parasites and infections. And these can oftentimes complicate and mask the overlying and the bottom line treatment and the diagnosis that you're seeing. So it's important to remember that not all things that itch are allergic, and really making sure that we're looking for infections, looking for parasites, and treating, getting those off the table is incredibly important for success in that patient. So making sure that we're looking for parasites with flea combings, skin scrapings to look for microscopic mites, potentially considering some treatment trials with anti-mite therapy can be beneficial to get parasites off the table. When it comes to infection, doing some cytology, whether it be impressions or swabs, to evaluate for the presence of not only bacterial, but yeast overgrowth that can also complicate our clinical picture. Now, certain diseases might require a bit more advanced diagnostic consideration. So when we have nodules or primary hair loss in the absence of itch, those might be beneficial to have a biopsy performed, and lesion selection and evaluation by a dermatopathologist can be incredibly important when a biopsy is obtained. If a patient has atopic dermatitis where immunotherapy is being considered, having that patient referred for intradermal allergen testing can be beneficial when we're formulating those immunotherapy mixtures. And then when deep-seated ear infection is present, having video otoscopy performed can help evaluate that external ear canal, take a look into that middle ear, collect samples that can then be submitted for culture to determine if infection is present. And again, all these are considerations that might be performed by a veterinary dermatologist depending on the condition that's being managed. So you mentioned that skin infections and allergies are common issues that are managed by veterinary dermatologists as well as general practitioners. So what sort of therapies are popular these days to consider for treating these common conditions when we have veterinary patients? So when it comes to infections, what we know is that we really are in an age where resistant bacterial infection is a big problem. To be perfectly honest, it's on a daily basis that I see a patient that has resistant bacterial skin infection. And so what we know is that a lot of times these isolates are resistant to the normal antibiotics that we use and that we consider. So in this day and age, we really have to be a lot more judicious in our use of antibiotic prescription to our veterinary patients. And so as such, with our patients that have skin disease, we're really relying a lot more on topical therapy, topical antiseptic properties that really help improve and can resolve the skin infection by itself. So using shampoos that contain either chlorhexidine or even dilute bleach can be really beneficial for treating bacterial skin infections, especially when they're resistant in nature. If we have a client that really can't bathe as frequently as we like, we also have the benefits of using some leave-on formulations such as mousse or sprays that can add that additional antimicrobial property even after a bath has been performed or in between baths. Additionally, medicated wipes can be used for certain areas that are maybe harder to bathe or harder to continue antiseptic, such as around the mouth, the lips, and in between the toes. Now, even a bit newer is LED light therapy, which can be beneficial for treating some of these skin infections. And the fovea unit from betaquinol is something that has recently come to market. Now, this basically uses technology that uses LED lights to lead to bacterial killing. It can be beneficial in some patients, but it's not perfect for all patients with skin infection. It's much more beneficial when we have more localized disease, given the fact that the light source only is about a few centimeters in diameter. So frequent application can be beneficial for some patients, but not necessarily for others. When it comes to managing allergic skin disease, it really is keeping in mind the pathogenesis of atopic dermatitis, knowing that it's not only dysregulation in the immune system, but also barrier dysfunction and genetics that really play into that allergic itch that we see in our patients. Managing allergies has really come a long way from using steroids that have a lot of side effects and a really broad target to now really focusing when possible on much more targeted therapies that have far fewer side effects in our veterinary patients. So using things like Apoquel and Cytopoint that really help target molecules associated with itch and decrease the level of pruritus that we see in our veterinary patients can be quite beneficial while not having the side effects associated with steroids. Improvement of barrier, the epidermal barrier function of the skin is also an increasingly important aspect of managing atopic dermatitis. And so using things like ceramides and essential fatty acids can be beneficial to really help improve that epidermal barrier. In patients where immunotherapy is being considered, we also have the option for a needle-free oral allergy drops that can be beneficial for clients that are a bit more needle phobic, but still wanting to use immunotherapy as a part of their pet's allergic management. Now, other things that are still on the horizon and are looking at and are being looked at from various aspects in the research world right now are various CBD products, as an example. We know that the cannabinoid receptors are increased in the skin of atopic animals, including dogs. And so using some of these CBD products might be beneficial for a component of managing allergic skin disease. Looking at some other ingredients, some plant-based therapeutics, either for improving epidermal barrier function or using some antimicrobial properties associated with that, just so that we have more options available, are also things that are being evaluated in veterinary dermatology. Now, mentioning that topical therapy is often used quite frequently. If that's part of the treatment plan, what ingredients are commonly prescribed? Now, when it comes to bacterial skin infections, over the years, there have been some standard go-to ingredients that have been incorporated for treating bacterial skin infections. Ingredients such as chlorhexidine, especially at the 3 to 4% range, can be quite beneficial. However, we do know that rarely we see bacterial these days that have mutation in a gene that leads to chlorhexidine resistance. So other options to consider: benzoyl peroxide, which can potentially be drying; trizidTA, which is beneficial for more gram-negative skin infections such as Pseudomonas, really more important for treating ear disease as necessarily for skin. It can work in conjunction with a combination of chlorhexidine. Now, when it comes to allergies, again, as I mentioned, there's different aspects of the disease and the pathogenesis that we like to consider when we're recommending topical therapy for our allergic patients. So given that allergic patients are a bit more prone to secondary infections, not only with bacteria, but also with yeast overgrowth, using an antiseptic shampoo as part of their management can be really beneficial. We do recommend frequent bathing to help remove some allergens and improve the skin barrier. So having ingredients that are antiseptic in nature can be really beneficial there. For managing pruritus, using things like either oatmeal-based shampoos when there's not infection presence, or even topical steroids applied to various body surfaces, especially if there's focal areas that require a little bit more help compared to others. And then, as I mentioned too, improving the overall skin barrier. So with either fatty acids or ceramides incorporated either in the form of a shampoo or a leave-on lotion cream that can be beneficially applied, especially when focal body areas are a bit more problematic. Now, when it comes to steroids, though, it really is important to keep in mind that the potency of that steroid matters. Some of those higher potency steroids, such as those contained in the Gentavet or the Gentacalm sprays, betamethasone, can be really quite effective. However, can lead to some cutaneous side effects if used long term. So we can see atrophy of the skin, essentially signs of Cushing's disease in our patients when some of these are applied a little bit more frequently. So if we're talking about longer term maintenance therapy, using perhaps a lower potency leave-on steroid can be beneficial to still provide some anti-inflammatory properties while decreasing some of the overall side effects that we can see if it's used much more frequently. Now, one thing that's come up is, what's the history of using dilute bleach as part of therapeutic recommendation? And is this something that's new? So dilute bleach has actually been used for several decades, not only in human medicine, but also with veterinary dermatologists too. This was first utilized and first incorporated by Henry Drysdale-Dakin, who was a British chemist that basically developed a solution along with his partner back during World War II when he was stationed at a field hospital in France. Basically, he was responsible for a lot of the wound care, and this was a day and age where doctors really weren't practicing much antiseptic technique. So there was a lot of infection, there was a lot of complications associated with this. And so what Dakin set out to do was to develop a solution that could improve the antiseptic nature of the conditions and really help manage those wounds overall. Now, this is where Dakin solutions came into play. And this has been used by veterinary dermatologists essentially for decades. Usually it's going to be formulated and applied as a rinse, oftentimes after a bath. It takes a lot of formulation with different ingredients, including sodium bicarbonate, dilute bleach, dilute sodium hypochlorite, as well as water. There's boiling involved. It's a very labor-intensive process that goes into making this solution. Now, this all sounds well and good, but are there any drawbacks to using Dakin solution in practice? And or do alternative options exist that do have these similar antimicrobial broad spectrum antiseptic properties? And how the downside to Dakin solution is that it really is labor intensive. So as noted, it really is applied as a rinse. And so what that typically entails from a process standpoint is a medicated bath where that's left on for about 10 minutes. The animal is then rinsed, the Dakin solution is applied, that needs to sit for another 10 minutes. Dog still needs to be rinsed and then thoroughly dried from there. That can really be a labor-intensive process, not only for the pet, but also for the owner that's applying it. As well, especially at those higher full-strength concentrations of Dakin solution, it really can be potentially irritating and drying to the skin, and it doesn't last for very long. It really needs to be discarded after about 48 hours. So if you have a patient where this is being used fairly frequently as part of the treatment management, you're having to remake that baking solution over and over and over again. Wouldn't it be nice if we had something that was a little bit more stable? Well, as it turns out, we do. So Command shampoo is a shampoo that contains not only a dilute sodium hypochlorite, but also salicylic acid. And this was evaluated in a peer-reviewed treatment trial that was looking at treating canine pyoderma, canine bacterial skin infections, using Command shampoo. And what the study found is that this is a really solid product that has a 3-year shelf life. It's ready to use right out of the bottle. There's no mixing that's required, so there's no labor-intensive aspects of making sure everything is measured out appropriately. In the study that was performed, the owners did not notice any dryness of the skin, even dogs that were bathed fairly frequently, 2 to 3 times a week. As well, in patients that had a lightly colored or white hair coat, the Command really helped to brighten and enhance the appearance of the hair coat itself. It reduced the odor, not only associated with the dog, but also the infection, and had excellent latherability. Clients hang on to that. They basically feel the nature of a shampoo is going to be determined in its efficacy on how many bubbles that they see. And so the fact that we have a very excellently latherable product is really beneficial and really gets clients on board for incorporating topical therapy as part of their animal's maintenance care. And as part of that, we know that allergic skin disease is a condition that's managed but not cured. And so given the fact that allergies affect a rather large percentage of the canine population, are there things that a pet parent can do that can help keep their allergic pet not only comfortable, but also healthy? When it comes to allergic disease, it really is common in veterinary medicine. It affects at least about 15% of the companion dog population. And when it comes down to allergies, we know that flea allergy dermatitis is going to be the most common allergic skin disease seen worldwide, but atopic dermatitis is going to be followed really closely after that. Now, atopic dermatitis is an allergic skin disease that has a lot of different components, not only in immune system dysregulation, impacts of the genetics, as well as the environment that the animal lives in, as well as barrier dysfunction. Basically, the skin is a bit leaky and allows allergens to penetrate through the skin a little bit more readily. Typically, this is due to environmental allergens, most commonly either various types of pollens or house dust mites and various dust components. So things that we can do for our animals that have allergic skin disease is really routine bathing and grooming practices. This is how we avoid allergens. We wash them off their skins. Not only do we want to avoid different allergens and exposure there, that we also want to make sure that diligent flea prevention is practiced. And so making sure that we don't have flea allergy as a contributing complicating factor in our allergic pets. When an owner notices a skin problem, it really is important to intervene sooner as opposed to later. Once we have a condition that's really chronic in nature, it has been set up for a long period of time, it can be much more difficult to resolve and can take a lot of time for those secondary aspects of the skin disease to really kind of improve over time. And so at the first sign of skin disease, the first sign of itch, the first sign of hair loss, the first sign of owner exudate is really when that animal should be taken to their general practitioner and or considered whether a veterinary dermatologist needs to be brought into the picture as well. Now, when it comes to managing allergies, there's a lot of tools in the toolbox these days. We have a lot of different medications. We have a lot of different topical therapies, immunotherapies, and it's really trying to figure out what's going to make the most sense for that particular client, patient, veterinary combination. Every allergic pet is different, and there's not going to be one set protocol that works for every single one. And a lot of times it's really going to be incorporating a combination of therapies that can be not only a bit labor intensive for the client, but that really going to have an overall benefit for that patient if we combine things together. It's also kind of making sure that if we have a patient with allergic skin disease, it's setting some expectations with our clients, letting them know that this is a disease that's managed, not cured. And that really what we're striving for is about 80 to 90% improvement for 80 to 90% of the time. And finding that combination of things that might include application of topical ceramides or using antiseptics such as our atopic creams, our Command shampoos in combination with other management for allergy can really lead to the better and the most important overall management of that patient. And so keeping in mind that once we find something that works, things just don't stop working. And so if the animal seems to be getting a bit more itchy, it might be that a secondary infection is really kept through, and that we really need to increase that bathing and or increase application and improvement of that barrier function. So that's what we got right now. Hopefully that gives a little bit of insight into how we use some of these products in our veterinary patients. And again, hopefully we have some good information, and thanks for those questions for our friends over at VetriMax. Right. Thanks very much. Have a great day.